If you get tonsillitis or a really, really sore throat, these are the things you need to do. You need to keep eating and drinking. It's really, really important because the pain of tonsils and the infection in that area causes cramp in the tissues around it. And what happens is that all the muscles tighten up. And even then, the pain gets so bad that you actually can't even swallow or anything like that. So make sure you keep sipping water, keep using those muscles because the cramp starts going. It's a bit like the cramp on the inside of your foot. You can take morphine, that cramp won't go away. You need to keep eating to get rid of that cramping sensation, or keep drinking water at least. Drinking water is really important as well because it rehydrates you. A lot of people get very dehydrated, they get headache, and they feel even worse with this problem. You should take some paracetamol. I don't know what you call it in America. I can't remember what it's called, but paracetamol, and you just need to take it regularly. You can gargle it as well. That sometimes helps as well. The next thing you should take is Brufen or diclofenac or some of these non-steroidal anti-inflammatories, and just keep taking these painkillers all the time. Don't wait until the pain really comes on and then take your painkillers. Take them regularly. Staying on top of the pain is much easier than climbing yourself out of a hole when you're in horrible pain. Painkillers work best when you're sort of keeping on top of it rather than digging yourself out of a hole. The next thing you can do is using a difflam spray or some sort of local anesthetic spray. That means the first bite of when you have that meal, when you're trying to eat to stop the cramp from taking over your throat, it sprays the back of the throat. It works for a few minutes. It may help a little bit to get those first few bites in. And then when the cramp loosens up, you can start eating and drinking again. Taking steroids, this is when you get to hospital. We often give people steroids, a dexamethasone or something like that, that calms down the swelling. So it means that you can eat and drink a little bit better. It also, what we say, potentiates the effect of the other painkillers. It makes the painkillers work even better. The other thing you can take is antibiotics. The antibiotics don't really help the infection because most of the infections are viral in origin. What the antibiotics are there for is to stop it from spreading to the rest of your neck, to your heart, to your kidneys. And it's not really helping the disease process in here, but it's just stopping you from getting worse or getting a bacterial infection on top. And if you're really struggling, some people, as long as you're not taking Nurofen or diclofenac or something like that, some people advocate using aspirin, dissolved aspirin, gargling it as much as you can and then spitting it out. Gargled aspirin has a great effect on resolving throat pain and things like that. Just be careful that it causes a lot of bleeding. So if you're on a period, or if you've got bleeding from your tonsils, or actually if you're a child, you shouldn't really be using aspirin either. So just be careful with aspirin. But it may be an option. Speak to your pharmacist or GP about it if you're really struggling.